Welcome to this webinar on SBIRT Medicaid Billing. Billing is an initiative of the Wyoming Department of Health, the Medicaid Division. Outreach and support for SBIRT is provided by YHealth as part of their Total Health Management Program for Wyoming Medicaid. The following Medicaid providers can receive reimbursement for SBIRT services. Patients and healthcare professionals working in a physician's office. This includes a nurse that is working in a physician's office. Anyone working under the umbrella of that healthcare professional can do the SBIRT screen, and that physician's office can bill for SBIRT. Health clinics, this does include maternal health care, home visits as well. Family nurse practitioners, advanced practice nurses with a specialty in psych and mental health, nurse midwives, and nurse anesthetists. Health centers and rural health centers can also bill for SBIRT, but it is not a direct billing. SBIRT services would be figured into the cost analysis, and it would be paid in the annual billing for federally qualified health centers and rural health care centers. These are the Medicaid codes available for medical billing for SBIRT services. The first code is H0049. This is alcohol and or drug screening, and this is anytime that the assist screening tool is used for a screening, the office then can bill H0049 for the rate of $24. The screen can be billed once annually. If positive for alcohol and or drugs occurs on the screening process, 0050, which is the brief intervention code, can then be billed. Billed in 15-minute units, and anything over 7 minutes is considered a 15-minute unit. This is billed at $48 for that one unit. Maximum of 4 units annually per patient that can be billed for a brief intervention. If the brief intervention goes over 15 minutes, a conversation happens for 20 minutes with the patient after the screen. That H0050 code can then be billed 2 times, even on one visit, total of 2 times 48 or for $96. That code is then billed in conjunction with H0049 because the screen would have been done on the same date of service. So H0050 and H0049 are billed together. SBIRT is billed in addition to a primary medical encounter for Medicaid clients who are 18 years and older. The diagnosis code that's used with SBIRT is going to be the code for the condition that brought the client into the clinic. The prenatal condition or postnatal, those are 2 diagnosis codes that are regularly used. These are services for other billing codes for SBIRT services. These are tobacco cessation codes. 9406 is a tobacco cessation counseling conversation over 3 minutes. That is billed at $13.53. 99407 is a tobacco cessation counseling over 10 minutes, and that is billed at $25.95. It is important to note that H codes and 99 codes cannot be billed on the same date of service. If you bill an SBIRT code along with a tobacco cessation code on the date of service, the claim will be denied. So back to this code, H0049, which is for screening, the assist screening, also includes tobacco along with alcohol and all the illicit drug questions. If screen is positive for tobacco, H0049 would be billed on that first screen. A subsequent screen, if those questions are asked again, the cessation codes are available for subsequent conversations, 9406 and 99407. The codes are billed outside of the SBIRT process as well. The assist screening tool does not need to be completed for these tobacco cessation codes to be used. However, since screening tool also screens for tobacco, it can be paid at a higher rate. If screening tool is used on the first time to see the patient, can bill at a higher rate of $24 as opposed to $13.53. We described a little bit better in the SBIRT billing flow chart. As you can see, the SBIRT codes are up here, H0049 and H0050, and these are tobacco cessation codes. So if an assist screen is completed, again, only once annually per provider type per patient, and if that screen comes up negative or low use for all substances, the screen is then complete, and it can take maybe 2-3 minutes to do, and that's billed at $24 using the billing code of H0049. Screen is completed and it comes up positive for alcohol and or drug use. H49 can be billed. The screen was completed with the assist screening tool. If a brief intervention is then completed, and if that brief intervention is under 7 minutes, H0049 will be billed. Intervention is completed at the screen, and it's between 7 and 15 minutes. Both H0049 and H0050 will be billed $4 and $48 respectively. If it's completed and a long brief intervention is happens after the screen is completed and units are used, both those units can be billed H0050. Again, up to 4 units per patient per provider type available for H0050. Is completed and it comes up positive for tobacco only, and a tobacco cessation conversation is completed on that initial visit, only H0049 can be billed. Again, do not bill H codes along with 99 codes on the same date of service, or will be a denial. Subsequent patients, after the patient has come in and screened positive on the assist screening tool, if that screen was positive for alcohol and or drug use, continued brief intervention can occur, and H0050 for any conversation over 7 minutes can still be billed at $48. This is up to 4 units. If the positive was for tobacco on the previous screen, we revert to the tobacco cessation codes of 9406 and 9407. The SBIRT billing codes are not used for a positive tobacco screen. Again, 9406 is for a conversation between 3 and 10 minutes. 9407 is for a conversation over 10 minutes. Implementation of the assist screening tool. The feedback report card for patients will be filled out when this screening tool is completed. It is scored, and all those scores are put on this feedback report card. A score for tobacco, a score for alcohol, a score for cannabis. Anything that the patient is positive for will be on this form. And if there is a brief intervention completed, there will also need to be documentation of the time that you took with doing a brief intervention. It's all important to document accurate nurse notes in records so that whoever follows you and may do a brief intervention a second time will be able to follow the SBIRT process. The feedback report card is either scanned into the electronic record or it is put into the paper chart, but this is documentation that Medicaid will be looking for if there is an audit. For information about SBIRT You can contact Vicki Parsons. This is Vicki's email address here. All the forms that you will need for doing SBIRT, the assist screening tool, and all the other forms are available on the White House website at www.wyealth.net. Doing this SBIRT billing webinar.